Hey friends, welcome back to I'd Like to Unsubscribe. Today's episode, buckle up, because we are diving into one of the most maddening and painfully common experiences in the chronic illness world. It's medical gaslighting. You know the drill. You're in pain, you're exhausted, you finally get in to see your doctor, and then bam, you get hit with a smile and a shrug. Your labs are normal. Maybe it's just stress. Have you tried journaling? No disrespect to journaling, but it won't fix my thyroid issues. If you've ever left a medical appointment feeling worse than when you walked in, and not because of your symptoms, but because of how you were treated, come pull up a chair. You are so welcome. We are talking about gaslighting, what it looks like in real life, what it looks like in appointments, and why it is so emotionally destructive, how it delays diagnosis, and most importantly, how to spot it and shut that crap down. We'll give you tools, boundary setting scripts, and ways to find a provider who actually listens and doesn't treat you like a problem to solve, but an actual person to care for. Because you are not too sensitive and you are not imagining it. And no, this is definitely not all in your head. What if the life you planned vanished overnight? For Marissa and Britt, it was painful chronic conditions without cures. We lost everything: our health, independence, careers, and even our sense of self. But in the wreckage, we found something unexpected: a chance to rebuild. Welcome to I'd Like to Unsubscribe, the podcast for anyone feeling stuck, lost, traumatized, or just straight up over it. This isn't about surviving illness or trauma. It's about ditching the toxic beliefs holding you back and even daring to dream again. We're bringing real talk, hard-earned wisdom, lots of sarcasm, and practical tools to help you rise. You'll laugh, you'll cry, and you'll remember, even in the darkest moments, hope is still alive.
Hey friends, and welcome back to I'd Like to Unsubscribe. Oh, and in today's episode, we are hitting unsubscribe on gaslighting, guilt, and it's probably just stress diagnosis, right? If you've ever been told that your symptoms are all in your head while your body is throwing a full-on riot, well, you are in good company. Today, we are talking about that oh so fun experience of feeling dismissed, doubted, or just downright ignored in a medical setting. So pour yourself something cozy or caffeinated, and let's unpack why you're not overreacting and why your gut instincts about your body actually deserve more credit than a 7-minute doctor's visit.
Oh, yes. The "it's just stress" line. Oh, that's the one I love the most. That's gotta love it. Or when they suggest drinking more water, like you haven't already consumed your entire body weight in electrolyte packets and hope. We're chatting about every millennial's new favorite word: gaslighting.
Yeah, girl. I think my purse is like actually maybe a half a pound heavier because of all of the hydration packets that are in there. So that's,
Yes.
I think that's normal, right, for all of us. But anyway, okay. So yes, thank goodness for the millennials, because this word is finally getting the recognition that it so desperately needs. And, I'm just so passionate about this topic. Britt and I were talking in the last episode, episode 9, just about injustices and how it just brings up this anger and frustration, and gaslighting is one of those topics for me.
Oh,
So,
yeah.
first off, what exactly is gaslighting? If we're talking about this clinically speaking, it's this form of psychological manipulation where someone causes you to question your own perception of reality. And in the medical world, though, it can show up when a patient says, "I'm in pain, something's not right." And the response is, "Well, your blood work and your labs are normal. Have you ever considered stress? Or maybe it's just hormones, especially for women. Maybe it's just that time of the month." And of course, that timeless classic, "You are way too young to be dealing with something this serious." See,
Mm-hmm.
medical Gaslighting, it can be especially tricky to spot because it's rarely overt and it's insidious. See, no one's shouting at you. Instead, it's a smile that is paired with this really dismissive tone, right? It's the subtle head tilt and the patronizing reassurance and that refusal to investigate further. It's the denial to order more tests or listen beyond a checklist. And it's when a provider completely overlooks the fact that you live in your body every single day. And just maybe you know when something is not feeling right.
Oh, absolutely. Because maybe we actually know our bodies. So, y'all, let me give you some, things of what does this actually sound like when you're in the doctor's office. So, it can sound like your tests are normal, so you're fine. Let's wait and see if this goes away.
Hmm.
You're probably just tired. That's not a real symptom. You're just looking for medication. Those are some
Hmm.
good ones.
Yeah. I mean, and I think Brit, sometimes it's not even what they say. And listen, they say those things all the time and they're horrible. It's also what they don't do, like not ordering further tests or not writing you a referral during that because, well, we're going to have you come back in 6 months and we'll see if it's still hanging on, right?
Mm-hmm.
Not listening to the end of your sentence before responding to you, and especially women here. And this is scientifically proven because we love our science. We've got the receipts to prove it. So the Journal of General Internal Medicine put out a study that doctors are found to interrupt female patients after, are you ready? An average of 18 seconds, but
Ugh,
they will let men speak longer before redirecting them.
ugh, such a yucky truth. Ugh, because y'all, like, here is the truth. When you are gaslit medically, you're not just dealing with the symptoms you already came in for, you're dealing with the emotional trauma of not being believed. It makes you second guess yourself now, and it chips away at your confidence. So now you're left questioning your own sanity and your own body, plus having to deal with your symptoms.
Yeah, which Britt, like we know that's not just frustrating, it's also really dangerous because when we have delays in a diagnosis, it means delay in getting care, right? Or treatment. And that can lead to irreversible damage. And I'm speaking from experience. I had 15 years of damage done to my body from lupus because back in the 80s and 90s, no one was testing for lupus.
Yeah. So not only have so many of us personally experienced this type of gaslighting, but there are so many stats on it. And normally Marissa is the stat girl, but I got them today because I was pissed off enough. So let's talk about the trust gap. And I just talked about this in a symposium up in Mass. And with our amazing sponsor, the Lupus Foundation, guys, it was amazing. But in 2020, there was a survey. Over 40% of patients with chronic illness said they felt dismissed or they were disbelieved by a medical provider. And y'all, it went from a 70% trust in the medical field, and now we're down to a 40% trust. And for autoimmune diseases specifically, according to the American Autoimmune Related Diseases Association, yeah, that's a mouthful, the delay in diagnosis average for patients, y'all, it's between 4 to 6, not months, years. 4 to 6 years. And this survey also shares that many of the patients that go through this 4 to 6 year time frame have multiple misdiagnosis and they've been dismissed and they had to go to multiple specialists. It's not like this chill time for 4 to 6 years. It's I'm dealing with my symptoms and I'm not being believed. It is atrocious.
Mhm. I mean, Brittany, how old is your son right now?
He's 5.
Okay. So imagine from the day he was born until now, if you were still waiting for a doctor to figure out what the heck is going on with you, right?
Yeah, yeah,
It's
absolutely.
insane. It's absolutely insane. I mean, you can basically almost have your master's degree before they actually give you a diagnosis. I
Mm.
like to put things into like those time frame perspectives. It's actually really scary. And the thing is, it's actually worse for women, especially women of color, right? And the disbelief runs deeper, and there are implicit bias studies showing that women's pain is underestimated compared to men's. I actually talk about that in Chronically Fabulous, my memoir. Um, And men are always treated quicker, especially for pain, in the emergency room, especially during things like heart attacks, because women present differently and they take men more seriously. So it's very scary to me. And autoimmune patients often hear it's in your head more than, hey, I believe you. Let's investigate what's going on here. And that's really sad.
Yeah, so that's just crazy. So it's like when we walk into a doctor's appointment, we're already in the negative, especially women. So of course we're going to be on guard. And it's not because we want to be difficult. It's because we've learned to brace for impact, right? Like we expect that we're not about to be believed. And so we're walking into a fight already.
I mean, honestly, that sentence is a sentence that I wish like every doctor could hear, because imagine being so sick and let down so many times and dismissed and maybe even made fun of. I mean, that happens too. When you, as the patient, are waiting, like you're waiting with bated breath for this appointment, maybe with a specialist for like 6 months, only to have this happen in the appointment, and all hope is lost. So of course we are leery of seeing another doctor, because gaslighting isn't just like this buzzword in today, it's actually an epidemic that is happening in our medical system. I believe that fully. And psychologists define it as a form of emotional abuse, right? Where someone causes you to question your memory or your perception of something or your sanity. I mean, it's really power through manipulation. And I feel like for us, like we're already questioning, like, is this really happening? Like, do I feel like this bad? Like, did I just feel something weird happen? And then we're getting gaslit on top of it. Of course, like we're just confused. We get like confused at this point. Like, what is actually happening?
Because in the medical context of all this, it's especially harmful because there's a power imbalance. We're not walking in as feeling like we're equals. We're walking in vulnerable, right? They are the expert, and we are already feeling really vulnerable because of our symptoms. We're not feeling like so strong. So when your symptoms are dismissed, it's not just annoying, it's destabilizing because our favorite word at I'd like to unsubscribe is the S word. It's safety, right? We need to feel safe. That is so important to the autoimmune community. And when we go in and we're not believed, it's destabilizing. It's not safe. So studies show that this repeated medical invalidation is going to lead to increased anxiety, depression, and PTSD symptoms. And if you have been diagnosed for longer than 24 hours with an autoimmune condition, you understand medical PTSD. Every time I walk into a doctor's office, my heart rate is above 100 beats per minute. I'm feeling shaky, I'm feeling nervous because my body is responding. I don't know if we're safe. I don't know if we're safe. So it's really hard because now you're dealing with your initial undiagnosed illness, right? You're still trying to figure that out. You are now potentially being re traumatized and more traumatized. And now you're having to deal with additional symptoms because nobody is looking at you and saying, let's lean in.
Well, and that's the thing, Britt, like all of this doesn't just impact our mind, right? It impacts our body. So chronic stress from being dismissed, again, can actually cause your cortisol levels to stay elevated. And we've talked about this before, which when that happens, your autoimmune flare-ups can worsen, and it creates this sort of loop and this cycle of just worsening health. So I feel like it's trauma disguised as a consultation, right?
Ooh, yeah. Yeah. That slaps, as the kids say. Yeah.
Yeah, that it's one way to put it. But let's talk about what gaslighting actually does to us as a person, right? Not just in that moment, but over periods of time. So, according to Dr. Robin Stern, who's the author of The Gaslight Effect, long-term gaslighting, it doesn't just bruise your ego, it actually chips away at your sense of reality, and it creates this chronic self-doubt, and it can affect your self-esteem. It could lead to anxiety and depression that you just talked about, and it can actually cause a very real disconnection from your inner voice, and that's the one that tells you like, hey Marissa, hey Britt, something isn't right here, right? So we don't want to be disconnected from that. Like there's a
No.
reason that God gave us that intuition. I'm going to talk about that a little bit later, but Now, take that dynamic and place it in a medical setting where someone with a white coat and a stethoscope and their clipboard looks you in the eye and says, "You're fine," even when you know deep down you are not. Something's not right. Your body has never felt like this before. The result of that is then you start second guessing everything, your symptoms, that gut instinct, your pain. You might start wondering, am I just being dramatic? Like, I mean, I felt that, right? Like, I'm not making this up. No, you're not. Like, and you might even start to emotionally shut down and you stop sharing with people, you stop pushing, you stop talking, and you shrink, right? When you're meant to advocate and speak up. And here's the thing, like, God gave us intuition for a reason, and we are deeply connected to our bodies. Like, we live in them after all. So when a medical interaction becomes so toxic that we begin to question the very signal that our body is sending us, that's not just frustrating, that is dangerous.
Yes.
Because,
Yeah.
right, in order to stay safe and get the help that we need, the answers that we need to be able to trust ourselves and to be able to speak up, even if our voice is shaking in that moment, even when we're told, no, everything looks normal in your blood work. Your body is not this big mystery. It's actually sending you a really clear message. And you have every right to be the loudest, fiercest interpreter of that message. See, and there's a reason like that trauma-informed care is trending, because the trauma of not being believed is real. Okay. I've seen it in tens, if not hundreds of people that I've talked to. It wires your nervous system for fight or flight in every future appointment. Like Britt, you were talking about this before. You walk in already on the defense. Okay. We don't want to go through the rest of our life like that. Like, we don't want every interaction with our medical team, whether it's at an emergency room or in a regular, checkup. Like, we don't want that to be that atmosphere of what we're walking into every single time. So Britt and I have some very specific stories of our own gaslighting experiences, and we've talked about them before we filmed this episode, and they're pretty hairy and they're really frustrating. And I have a funny feeling that you're going to be like, wow, something like that also happened to me. So we're going to do a quick break and we're going to hear from our amazing sponsors that actually make this podcast possible. And we will be back in a minute. Trying to figure out what's triggering your symptoms but can't put your finger on it? Try Folia, a health tracking app to help you connect the dots and get to the bottom of what's going on. Download Folia Health free in the App Store with invite code LupusChick. Folia is the one app to track it all. Learn more at foliahealth.com/lupuschick. That's FOLIA health.com/lupuschick. Ever wish you could be paid to share your chronic illness story? The Insights, like things you know, matches you to paid interviews, focus groups, and surveys to share your experiences. Visit theinsiders.com to check out our current opportunities for lupus patients.
Are you experiencing symptoms of lupus or feeling alone on this journey? The Lupus Foundation of New England is here to help you. They're dedicated to supporting those living with lupus, offering education, resources, and a community to help you navigate the journey. From learning about symptoms and testing to upcoming events and research, the Lupus Foundation of New England has you covered. Visit lupusne.org and connect with others who truly understand. You don't have to do this alone. Visit lupusne.org. That's lupusne.org today. Hey guys, thanks for continuing to join us because we know you're curious. You want to hear those really gory, bad stories. And we got some for you. We got some gallows humor that's coming up. So here are a few of mine. So, I was like, man, which ones do I even talk about? Because sometimes, and especially when you're already having to do some research on it, you're like, have I been gaslit? And then you look at the research and you're like, oh boy, I've got a few stories. When I was first being diagnosed, no joke, true story, hand to God, my current practitioner told me that all my very, very classic Hashimoto's symptoms, I was, fluctuating in weight. I was having anxiety, dry skin, I'm just all the things. I couldn't have any body temperature issues. All these really, really classic symptoms were because me and my husband were infertile. So he, no joke, made me lay in a dark room and say out loud for 30 minutes, I am infertile, while I cried. And then he walked back in after and was like, see, you're cured. You're welcome. And I paid him. And I paid him for that evaluation. And then about a month ago, I had to go to the hospital. And I was in so much nerve pain. And I'm used to, y'all, we're used to weird symptoms. That's not a new thing for us. I'm used to weird, bad symptoms, but it was so bad that it actually paralyzed my vocal cord. And so I was talking like this, and it was super sexy. And I walk in, and I'm trying to explain this to this guy, and I'm like, I'm just having some really bad nerve pain. And he, no joke, looks at me and goes, do you want a muscle relaxer? Like I'm some 1950s housewife who got the fevers, and I just had it was ridiculous. I was like, why would I want that? And, so it's crazy. But recently I decided to brave hope again. And y'all will get that, right? Like, you spend all your Bridgerton dowry on a bunch of medical tests because, we're not rich. And you try a boatload of medicines and supplements and all these different things, and it turns out to be a bust, right? And you've placed all your hope on this. And you don't feel great still, but you don't have the emotional or physical capital to try again right now. You're done. But then you wait, and the symptoms don't go away because it weirdly wasn't just stress, right? The symptoms ratchet up and up and up, and they get weirder, and your ability to be chill about them starts to fade. So you decide, okay, I've got to brave hope again, and I'm going to try a new doctor. So I'm finally at this stage, y'all, and I decided I was going to doctor shop this time because I was braver and stronger, and I was more educated. So I had a list of questions for the next doctor, and they really had nothing to do with my symptoms. It was, I'm going to ask about their practice and their desire to partner with a patient and why they decided to even get in the game to begin with. So I do what every good, patient does, and I Googled local functional medicine doctors because apparently they're the ones who are supposed to be the most curious of the bunch, right? And I get a hit on this local doc that has good overall Google reviews. So I decide, okay, I'm going to set up a free consultation. No harm, no foul, right? Mm-hmm. It's supposed to be Zoom because I wanted to connect as a human. I wanted to see his face, but he calls me anyway. So beige flag, right? We're going to just fly that beige flag. I answer the phone to this loud Italian man. And y'all, I love my Italians. I love Marissa, right? Nothing against my Italians. And I start by trying to explain why I made the appointment, but he is already, within a few seconds, assuring me that he has all the answers and he'll find a cure. Mind you, I have been sick since I was a kid. So, pink flag thrown there, right? Okay, we're getting closer to red, but maybe he's just really wanting to be positive. Then he cuts me off mid-sentence to say, hey, doll, how old are you? You sound so young. Ugh. Blaring red flag thrown, the reddest of the red, right? He tells me he does this particular blood work through this particular lab. But when I look over the tests that he's going to be doing, he texts them to my phone. It's literally all tests that I have done before and many, many, many times before. So I'm like, hey, doc, I've already done all this. But he assures me, no, this lab is super different. And I'm like, because they make their own results? I was very confused by that. So I tell him, well, hey, my insurance will cover these tests at a traditional lab like a Quest or LabCorp. But he insists that they must be done through this specialty lab because it comes with this mapping printout. So is he then telling me he's basically going to read me this piece of paper? Why would I pay him anything? So he sends me the link to the blood work that will cost $500, no joke, within 7 minutes of our conversation together. And the loco banana sandwich, part of it all, is I still almost paid that man. Y'all. And we have a podcast about advocacy, y'all, because the quest for hope is so strong. And he's a doctor after all, right? We talk about that power imbalance, and I'm just a patient and I don't know as much. Ugh, right? Like, ugh. And even after all these years and a podcast, I still totally fall prey.
Yeah, but I mean, I feel like we're all right there with you though, because we want answers. And that is in this world that we have created, like those are the people that are supposed to help us find those answers. Okay. So we
Yes.
just think like, all right, well, if this is the process and again, this is my only choice and this is what I have to do, then this is what I have to do. Right. But as you and I know, and I'm sure many people that are listening, there are good doctors out there and there are not so good doctors. But first off, on that note, hey doll, how old are you? Just sounds so particularly creepy to me and like not something I would ever want to hear a doctor say to you under any circumstance. But second, that
No.
story, it just makes me so upset. And I think just upset because the fact is this goes on hundreds, if not thousands of times every single day in our medical system here, right? So guys,
Yeah.
I literally just gave a TED Talk on April 23rd about these topics, and hopefully they'll be out soon so everyone can watch it. But yes, this is our first time recording since that day, and it was literally the most amazing day of my life. But part of that talk was on gaslighting and like that disbelief that is embedded in the chronic illness world. So some of you here may know some of my story, but long story short, I got horrifically sick at the age of 8 and I suffered until I was 23. So I was 15 years old. And I was raised by a single mom and we were extremely low income. And my mom would work 2 to 3 jobs to save up money and to get me to a different doctor to just try to find answers, right? Only to be met with, it's just heat stroke, it's her allergies, is she not sleeping enough? No, jackass. Like I legitimately had the most clear lupus textbook criteria symptoms: fevers, rashes, joint pain, mouth and nose and scalp sores, anemia, and the icing on the cake, extreme sensitivity to sunlight. And in 15 years, and I can't even count how many doctor's appointments and hospital appointments, no one could figure it out. And I've thought about this. I mean, maybe it was because it was in the 80s and 90s and you never heard the word lupus. Or maybe it's because I was a child and somewhere in the back of their mind, like we talked about, they thought, oh, she is way too young to be that sick with a disease like that. But honestly, I think it was also a lot of this gaslighting circus of male doctors seeing a poor single mom with her child and poo-pooing it and not being curious or maybe thinking like we didn't have the extra money. So they didn't go that extra mile and run more blood tests that maybe could have pinpointed. So they over and over again took her cash because we didn't have health insurance. And they sent us on our way every single time with zero answers and zero options. And so here's a story within that story. Because part of me, when I was selected to do the TED Talk, felt like in a way that TED Talk was going to be sort of this vindication for all of those horrible gaslighting experiences. And I didn't want it to happen to anyone else. But then something really unexpected and remarkable happened. So I trained for months for the TED Talk. It's part of the process. And very early on, one of my coaches got swapped out for another coach. And to me, looking back, it's all the hand of God. But the new coach was literally a retired nephrologist, okay? One of the main doctors that works with lupus patients. So if you've never been to one, it's basically a kidney doctor, and kidneys are a big part of the lupus world. And I remember the first time I was with him and my other coach on Zoom, and he heard my story for the first time, and he heard my rough draft of the speech. He just stopped the meeting and he said to me, in all seriousness, with the most empathetic, compassionate tone, he said, on behalf of the medical profession, I want to apologize for what was done to you because it was a travesty and it was negligent and you shouldn't have suffered like that for most of your life.
Give that man a hand clap. Yes. Yes.
He needs an award, like he does. And he even told me like how frustrated he is with today's medical system. And this was a man that was a doctor his entire life, right?
Mm.
And I will tell you in that moment, it was like almost a lifetime of frustration at those doctors in that really deep pit in my stomach that if that pit could talk, it would say, why didn't you help me? Like I was so little, I was so young, and I was so sick. Well, a lot of that got lifted when he said that to me. And I started crying on the Zoom with him. And he was like, are you all right? Like it was, which we know here, I'm not like a huge crier, but in that moment, it was like that 8-year-old girl who was terrified and really felt terrible and was falling apart. Like when she was finally seen, right? And it happened almost 40 years later by a medical professional. So I share all of this to say, and if you take only one thing away from my story, let it be this. Gaslighting in the medical system does not just hurt, it devastates people. It leaves people questioning their bodies, their reality, their worth. It offers no solutions, only shame, no care, only confusion. And the trauma it causes doesn't just disappear when that appointment ends. It lingers and it shapes how people trust or don't trust the very system that is supposed to help heal them. So, for any medical professionals listening, and this may sting, if your ego is louder than your empathy, it is time to recalibrate because patients are not making this up. They are already carrying so much. And when you dismiss and belittle and ignore them, you don't just miss a diagnosis, you leave a scar. So please remember your pride should never come before your patient's truth. And when you gaslight us, you steal our hope. And sometimes that betrayal cuts deeper than any illness that we could be diagnosed with.
Mm. And girl, like when I hear your story, and it's not like it's the first time that I've heard it, but like you used the word today, I was so little. And I think about my own kiddos, and I think even about my own story of when I was so young and I was going through a ton of medical testing and the innocence, right? Like we're always this consummate child who's saying, "Will you believe me and will you protect me?" Right? And that's what we're doing with doctors, and it's so violating.
Mm.
And it's so enraging, like we talked about in the last episode, this the injustice of what you went through because your story didn't need to be as painful maybe as it became because you would have been believed and then you would have gotten the treatment you needed earlier. And it's just
Yeah.
it's so frustrating and I'm so sorry, right? I mean, and to everybody cuz we realize that this is not unique stories. These are not just sensationalized stories for some podcast to make it more interesting. I know every single one of you can go on Instagram and blow it up right now and tell us, and please do, how were you diagnosed? How long did it take? Like, we want to hear. Maybe we're getting it wrong, but I don't think our data is. Like, what's your story? Because it's hard. And I'm so sorry that we've had this select group of doctors do this to us, but here's the like even deeper, like darker part of it. Like the twist of it all is that not every provider who gaslights us actually intends to. It's not like they woke up that day and they're like, it's not like a mustached man, twirling it, seeing how they can screw up someone's life today. Like and if we can have empathy with each other, we got to lean into their stories too, right? Like they're burnt out. Some of them are burnt out. Some are literally trained to dismiss what they can't immediately quantify. They live in a science world and we have all these symptoms and they just don't know what to do with it. And some are honestly thinking that they're being reassuring to us when they say your labs are normal. Congratulations.
Right.
Like it
Welcome.
don't. Yeah, you're welcome. See, it's all right, and don't go in with this like dukes up thing because quite frankly, we can't do this really without them. And whether you go traditional medicine or naturopathic medicine, I'm a crunchy mama, I tend to veer towards them, but I still need practitioners to work with me. So we need the medical field. And if we're going to go in like fighting like it's malice, it's not always that. Go in curious too, with a sense of grace, because sometimes it's just a lack of training or usually lack of lived experience. But just because it's unintentional doesn't mean it's not harmful. And it doesn't mean that we can't do something about it, right? So one tool that we find is really helpful is to invite curiosity. And if should be on them, but if it's not, then it's on you. Invite in curiosity. So start by you saying, hey, I know this doesn't fit this textbook case, but can I walk you through what it feels like to be me? Like invite that in, or, maybe try this. I'm not asking for a diagnosis today. I mean, surely we would love it, but we get it, right? I'm just asking to be taken seriously enough to explore this together. Like you're the one setting the tone with this doctor. You're inviting them in to the process and saying, this is what I need from you too. And I think that's a really great place to start.
Yeah. And I think if you're in that appointment and they shut down your concerns too quickly, you can try something like this. Like, I hear you, but I still feel like something isn't right. Would you be open to digging in a little bit deeper with me? It keeps that tone calm in the appointment, but you're also asserting your need, because we're not trying to start fights. Like, we're trying to get help. We don't want to create this distance between us and the provider. We actually want to determine in those appointments, who can we actually build a team with, right? Because that's how we're going to get answers and we're going to get further along. And sometimes I think giving a provider the benefit of the doubt while holding your ground can lead to a really productive conversation.
Yeah, absolutely. Like the first thing we want you to hear is to not go in and A-bomb your relationship with your doctor. Like try to repair it. But like in any relationship, yeah, you go to your counseling together. You try to figure it out together. But when you've tried these things and it doesn't seem like it's working, right? You've tried the conversations, or you try to get your provider to lean in and they lean back. It's time for the it's you, not me conversation. Because life is, in fact, too short. We have but one shot at this beautiful life, and it is hard enough to feel the way that we do. We don't have to add to our own misery by staying in an abusive medical relationship. Sometimes you need to say, sorry, this doesn't work for me, and then move on and get out of there. Okay, so say you've tried the things and now you had to have the breakup conversation and you're now in the market for a new provider. If we don't do our own, recollection of what happened, right? Like in any breakup, if you just walk into the next relationship and be like, this one will be better, without having gained some knowledge, gained some chutzpah from it, we're just going to find this next provider that's the same thing. So how do we start to find one who doesn't make you want to scream into the void? How do we find someone who won't gaslight us? Well, first, and I think what Marissa was talking about, is that we have become so pre-programmed to stop believing ourselves. But I think all of us innately, because of the feelings we have such a higher sense of, sensitivity. And I'm not meaning like delicateness. I'm meaning like we are really aware of ourselves. So lean into that superpower, lean into that strength, feel out the vibes, and not in like a, Marissa says, like a woo-woo way, crystals in the corner. I'm talking about when you walk in and you are with this provider, does your body and the way that you are posturing, do you feel safe? Do you feel heard? Are you leaving feeling smaller? Like listen to that gut, right? If you feel unsafe, small or steamrolled after the appointment, that is a blaring red flag, right? That's your doctor calling you doll, That's your clue, right? And I just heard this amazing line from a researcher at the symposium I spoke at, and I adored her. She said this thing, and I haven't stopped thinking about it. She said, I tell my patients, if you don't think we could be friends outside of this office, then maybe I'm not the right provider for you. And I love that. It felt so simple from when we're trying to second guess ourselves. When you leave an appointment, and if you can think, I think I would like to go have dinner with that person. I'm not saying you will, but if you have that vibe about them, give them a shot. If you walk out feeling like you want to cry or you feel smaller, don't go back. That's not the relationship for you.
Yeah, exactly. I think you have to listen to that intuition. And, obviously when we go into an appointment, depending on how awful we feel that day, how long we waited for it, all of our expectations, like there's a lot of things that all happening at once, right? But if we can just stop and we're sitting in our car for the couple of minutes afterwards and just be like, all right, like, how am I feeling about that whole interaction, right? Even write down, I send texts to myself because sometimes I don't remember it later on, but I'll just write down little things that I noticed. And I'm so glad that I have those to look back. But I love that. I remember you telling me about that after the symposium. And I'm just thinking I love that some providers are thinking in that way and they're expressing it, because I mean, the reality is your doctor doesn't need to be your BFF, right? That you're talking to every day, but you should feel like they respect you. Like you said, Britt, if you went and had a cup of coffee with this person, you could have a good conversation. There's a good connection. Like they see you as a whole person, not just this chart that they need to fill out and close out to get to the next one. And I think don't be afraid to ask questions up front so that you can see if that connection really exists. And it could be things and you might totally throw them off guard with stuff like this. And maybe they have to think about it for a second, because maybe this isn't their typical question, but how do you handle complex or hard to diagnose cases? What's been your experiences in the past? Have you, worked with someone that maybe wasn't able to get a diagnosis elsewhere? And how did you go about that? Right? I mean, give them a chance to actually talk about their successes and things that they've been able to find. I think that you'll see a very different side of a provider when you ask things like that.
Yeah.
You can ask how much do you collaborate with your patients? I have some doctors, they're all over my chart, emailing in response to me. Britt, you and I have had functional medicine doctors that literally text your phone. I think it's good to know those things. What's that level of communication? No, I don't expect you to text me all day long. You obviously have a million patients and a million things going on, but it's nice if a doctor actually responds and you can have a communication outside, right? But you've heard this before. It's kind of like a job interview, except you're the boss this time. And I think it's really important to remember, doctors are human beings. Personalities matter, just like when you're meeting a friend or an intimate relationship, right? You're allowed to choose someone who doesn't just have the perfect, credentials that you need, but there's also a really good energy there, because especially with chronic illness, this is going to be a long haul relationship. So just like your intimate relationships, we want to make sure that this clicks on a variety of levels, not just because, oh, you went to Harvard or you went to Stanford, so you must be a great doctor.
Yeah. Yeah, exactly. Yeah. It's would you ever date somebody just on credentials, or are you actually dating the person because you like them, right? And again, not that your doctor, well, you probably shouldn't date your doctor. I don't know. That can get complicated. Maybe another episode. We'll talk about that later. But you need to be able to invite curiosity. And because it's one of the best tools in the doctor's bag, a provider who says, that's interesting, instead of, oof, that's unlikely. It really changes everything. And if there are providers listening, we're not trying to just, jump up your butt, but we want you to know, that lean in matters. We understand that you may not know everything. And I think what we hope you don't take away is we expect you to be these superheroes and know absolutely everything, because you can't. I mean, I'm an attorney, but my area of law is so, confined. If someone's like, can you do a will for me? No, like I can't. So we understand that you're not going to know everything. And saying, hey, I don't know what this is, but I'm sorry, or I'm curious, or, but I believe you. Like, that's all we need. It's not a, you must give me a diagnosis or you're a crap doctor. No, it's just simply, wow, that must be really hard. I'm sorry. I wish I could help you more. We will leave that appointment with a smile on our face. And we didn't get a single answer. We may have waited 6 months, but we're still going to feel like, well, at least I was heard and the hope was worth it. The
Yeah.
hope is still there. So when a doctor listens longer and asks better questions or simply just says, hey, I believe you, it really opens the door for healing for us. And that's
Yeah.
really what we're looking for. And
I may not have the answer today for you or can get you on a treatment right now, but we're going to figure this out. Like I'll do everything in my power. We're going to go the long haul. We're going to figure this out. So you're right. You're leaving there with hope that is
yes,
going to carry you on because it's going to be a journey. Like you said, 4, 5, 6 years for most like diagnoses, right? With autoimmune and whatnot, like you need hope to get through that time frame. I mean, that is not easy. Um, but in the terms of gaslighting, you might wonder, like, have I ever been gaslighted? Like maybe you're not even unsure. So here are some takeaway tools for how to spot if you're dealing with some medical gaslighting. So we want to look for these types of signs, right? You're talked over or you're interrupted before you can even share about all your symptoms or what's going on, or you feel dismissed or belittled, and maybe the doctor won't further explore or do the adequate testing. Maybe they blow it off as something purely psychological. Oh, you have a lot going on right now. It's anxiety. I know that happened a lot when I was in college. It's just stress. You need to sleep more. Maybe the doctor seems more focused on what's on their screen than what you're telling them. Okay. That's a big one that always irritates me. And I will literally stop talking until they look up at me. And then, I'll just say something like, can I continue? Or, and it kind of just throws them off guard, gets their attention. Maybe they don't document or follow up on your concerns. Frustrating. And I think the big one is, do you feel worse emotionally after that appointment? If you're leaving there so frustrated, maybe you're crying, maybe you're feel completely let down, like, oh, I just waited for how long and I got like literally no answers. Those are things that I think that you need to consider and also maybe keep a note of so that you don't forget, right? Because this is going to hopefully be a long-term relationship. So we want to notice those types of red flags early on so we don't continue and get ourselves in too deep here.
yeah, because honestly, y'all, if those things are happening, those are beige flags. Those are American flag at a football game, like sized red flags, like they're huge ones. So don't ignore them. Don't minimize yourself. Don't
Mhm.
join in on their gaslighting and then gaslight yourself over them. Like listen to the flags.
Yeah. And I think, like if you do see that happening or if it's happening like during an appointment or maybe you're in the ER, whatever it is, what do we do when that happens? Well, these are a couple boundary setting phrases you can keep in your back pocket. You can tailor them to your own language. These are just things that Britt and I talked about. And they could sound something like, well, that might be true, but I'd still like to rule it out. Or I'd like these symptoms documented in my chart. You could also say something like, telling me it's just stress without actually testing for something, it feels really invalidating and unsafe to me. Trust me, like hearing that, I think most doctors are going to be like,
Yeah.
let's start doing some testing
Yep.
here.
Let's do some testing.
Yep. Because you are willing to advocate for yourself. You can also say something like, can you help me understand why you're unwilling to explore this further? Mm, that's a good
Yeah.
one. I want to feel confident in my care plan, but right now I feel like we're missing something important.
Mm,
It's honest, something like, I understand you're busy. I'm not really comfortable though leaving here without a plan.
mm.
Another good one. And one of my favorites, I don't want to wait and come back in 6 months to see if this has gotten better or worse. It's affecting my everyday life, and I want to start looking for answers sooner rather than later because I think a lot of us are brushed off of, well, let's do a checkup in 3 to 6 months and see where we're at with this.
Oh, and when you're saying those things, there's part of me going, oh, like, oh, can you say
Can we
that?
say that?
Because I would do it for a friend any day. You bring me to your appointment, and I'm gonna be like, well, doctor, but for myself, can I say
Mm,
that for myself? Am I being a bully? Am I being mean? You don't have to yell it. What is being outrageous about you saying, I'm sorry, can you help me understand that more?
mm,
That's literally what the relationship is about. And being able to have that self advocacy is going to get you to answers faster too, because you're saying, hey, I'm not willing to just sit here and wait it out. I
yeah.
want to know, and please tell me more. And for serious, you may want to bring a notebook with you, because I
Yeah.
walk in there and my brain goes, who am I? What symptoms have I been having? And the only ones I can think of are like the ones I'm experiencing that day. But for 6 months, I've been dying. And I'm like, I think I'm fine, And so bring a notebook, have your symptoms written down. If you need something to help you, have that tracker. Folia Health is a great one for that. Like
Hmm.
keeping your symptoms so that you know and you don't like freak out in the moment. Wait, here it is. This is what I need to talk to you about, because the appointments take forever. And
Yeah.
then if you need to cry in the car later, like I usually do, that's fine. Let that release come out too. But do not gaslight yourself just because someone in a white coat did it to you first.
Mm.
This is not how it works. And if your doctor doesn't listen, doesn't seem to care, or doesn't take your pain seriously, you 100% have permission to break up with them. It
Yeah.
is not personal. This isn't like, oh, now I've got to get my stuff out of your house. No, it's not personal. It's protective. It's
Yeah.
protective of your time, your energy, even your family. Y'all, if you can't do it for you, do it for your family and the people that you love,
Yeah.
because they only have a short period of time with you. And we're not saying because you're going to die soon, but we are given 80, best, 90-ish, if you're crazy,
If we're
100
lucky, yeah.
years, if you're lucky. And our people want this good time with us. And so we need to be able to take that breath and put our shoulders back and say, I'm doing it. If I can't for me, I'm going to do it for them. Be protective of yourself.
Yeah. I mean, like you were just saying, Britt, I mean, your life literally depends on it. So if they do not want to hear you out, if they are not willing to go the extra mile, find someone else. Like they're out there. We just sometimes have to dig, a little bit deeper. So if you've ever walked out of an appointment feeling small or crazy or crushed and completely defeated, just please hear me and Brittany today. You're not the problem. You deserve to be heard at your appointments. You deserve to be believed. No, you're not being too sensitive and you're not exaggerating it and you're not imagining any of it. And if you're looking for validation, well, then you've got it right now from me and Britt. Like, stick up for yourself, advocate for yourself, and know the signs before you're walking into, so that if it does happen, what is the response that you're most comfortable with, and just kind of have that in the back pocket so that if you need to use it, it's there.
Absolutely. Because medical gaslighting is real, but your stories, your symptoms, and your voice matters more. So unsubscribe from that silence and from the shame that comes with it, from pretending you're fine, and start subscribing to your own voice and your life, because we're with you. And if you need help crafting that
Mhm.
breakup, that Dear John email to your old doctor, you
Mhm.
know where to find us. Connect with us on Instagram at I'd Like to Unsubscribe, and let us know your gaslighting stories. We really want to hear them.
Mm-hmm. And Brittany and I will write that letter up for you real fast. All right, friends. Well, we know that this was a whopper of an episode, and it is a topic so many of us have experienced. And Britt and I are really passionate about it. And we would also really like to hear your stories on medical gaslighting, because we know you have them. So you know where to find us. But until next time, take your meds. Yes, all of them. Speak up, even if your voice is shaky. And for the love of sanity, unsubscribe from gaslighting. permanently. Block it, report it, send it to your spam box because you deserve answers, not eye rolls. And we will catch up with you next time.
Love you, tribe.
Bye.